Now, you have about a month until your delivery, and your provider is recommending you do a vaginal to rectal swab for a bacteria called GBS. Now, this sounds a little weird, but what is this? Why is this important? We got you covered in this episode. Welcome back. This is the New School OBGYN, and we're right in the middle of the expecting series. We're working our way through the pregnancy and what both parents need to know going through it. It matters where you get your information. With that being said, my name is Eric Schmidt. I'm a board-certified OBGYN. Today we're talking about GBS and why it is so important. Now, we want to do whatever we can to help protect our little babies once they're born because they're so susceptible to a lot of different things. And one of the things that they can be particularly susceptible to is an infection called GBS. It's a rare but serious infection that can happen to these little neonates, especially if the baby is preterm or low birth weight or potential other risk factors. Since this bacteria was found out to be making some very young babies really sick, we've learned how to better prevent it from happening in the first place, and that is often giving antibiotics for those moms who might have this bacteria, because about 50% of those babies born to mothers with this bacteria may have contracted that infection, and they can get potentially very sick in certain situations. Since we started giving these antibiotics in labor, we've reduced the infection rate by 80%. Okay, let's talk a little bit about the GBS bacteria, or Streptococcus agalactiae. Now, this is a bacteria that often can be in adults in their lower GI and genitourinary tract normally and not causing any symptoms. Since we're screening moms at the end of their pregnancy, we find this to be in about 10 to 30% or 1 in 4 of all pregnant moms. It can be transient or it can be persistent, meaning moms might test positive in multiple of their pregnancies, or they may test positive or one and maybe not the next. If you could take a quick second and subscribe to our channel, it really helps us out, really motivates us to continue to put content out there for you guys, the viewers. So the first question, when are we testing or when are we screening moms for this GBS bacteria? This is going to be at the 36th to 37th week of a pregnancy if we're expecting that baby to deliver around their due date, because we often say that this test will expire or the result will expire if it's 5 weeks past the result. So we don't want to do it too early. For example, we don't do this at 32 weeks or 34 weeks unless the delivery is expected to be within 5 weeks. So for a normal pregnancy, we're usually screening moms at the 36th to 37th week. What this screening test entails is that it is a swab or a Q-tip that goes from just within the opening of the vagina or the introitus, swabbing just maybe a centimeter within, swiping down the perineum, and just within the anal rectal opening also. And so another frequently asked question that I talk with my patients about is, yes, you can do this test on your own. You don't need the provider to do it. I would say it's about 50-50. Some patients feel very comfortable being able to do this. Some patients would like the provider to do it for them. That's up to you, something you can talk to with your specific provider about. You just have to make sure you do it correctly because this is not something we want to miss. Okay, now you're in labor. And so who gets treated for this GBS bacteria? Of course, the one who tested positive at their screening test at 36 to 37 weeks is going to receive antibiotics in labor. Usually it's a penicillin antibiotic. We'll talk about other options here in a second. As we mentioned earlier, moms that have a UTI early on in the pregnancy or any time in the pregnancy, and the specific bacteria that causes it is the GBS bacteria, we consider that patient to have the GBS bacteria, even if we treat it with those antibiotics, and we still recommend that that patient receive the antibiotic while they're in labor also. If a mom in a previous pregnancy had a baby that was positive for the GBS infection, we treat all of those subsequent or next pregnancies with antibiotics in their labor to help prevent, because we know that that mom is likely a carrier of the GBS. We also do have a treatment algorithm for patients that maybe labor prior to having their GBS test done. If someone doesn't have their GBS test done and they're before 37 weeks, or term we call it, then we would likely treat them with any of those antibiotics that we talked about. Question, which antibiotics do we use? Now, the GBS bacteria is really susceptible to penicillin, which is a well-studied antibiotic for both moms and babies, and so this works really well. However, it's quite common that someone might come with a penicillin allergy, and so we do have options besides that. When every culture is sent to the lab, if that patient has a penicillin allergy, they'll automatically test it for susceptibility to other antibiotics such as clindamycin and erythromycin to see if it's susceptible, and we might use clindamycin as an option. If it's not susceptible, we'll use vancomycin. That was probably a little beyond the scope of this talk, but just letting you know there's options, so let your doctor know if you have an allergy to penicillin, and we'll help you figure out if it's a more severe allergy or a more mild allergy. That might depend, because if it's a mild allergy, we give another medicine that's, again, beyond the scope of this talk, Eric. Anyway, we might give another medicine called cephalosporins. Another frequently asked question is if you're planning on having a C-section, do you still need to get this GBS test done? And this recommendation still is that we do this even in patients who are expecting a C-section, because there is a chance that prior to your C-section, you could go into labor at home, water could break at home, which then would invite potential bacteria within the amniotic sac, and there would likely be hours of interval of time prior to leaving your home to getting your planned C-section. So we just do that to, again, to help protect baby, to let the baby doctors know, hey, there was a positive GBS test. Just watch baby a little closer for this bacteria. Now, when we're talking about a certain thing, often we want to know, is there something I can do to prevent this in the first place? And really, honestly, we don't have a great idea whether or not GBS can actually be prevented, or if it is just a normal finding in some people. Again, about 10 to 30% of moms will have this bacteria. Some people think that maybe probiotics could help decreases the chance of somebody having this GBS bacteria take place. Not great evidence about it, or zinc supplementation, not great evidence showing that. It actually is kind of disproven that extra zinc supplementation. So just take your regular prenatal vitamin. You don't need that for this reason. But yeah, we still need to learn more information about ways we can potentially prevent possible adult humans from getting this GBS colonization, but as of now, no great way to prevent this from happening in the first place, unfortunately. Thanks for sticking around. I just wanted to summarize because I feel like I left some of the questions a little bit unanswered when making this video. And number one, does somebody need to worry if they have a positive GBS test? And overwhelmingly, the answer is no. It's a pretty common thing. Again, approximately 10 to 30% of women in their third trimester will test positive for this. And so please try not to worry if your test comes back positive. And also, please don't feel like, I've had patients say they feel gross because of this positive test, or feel like they have an infection, and that's not the case. This bacteria just lives in and around our body sometimes. And so don't feel bad if you have that test. The antibiotic is a safe way to protect your baby as they're delivering. And so don't let anyone else tell you otherwise too on the internet. I've seen some videos saying like, oh, I didn't take my antibiotic and my baby was fine. It's like, yeah, because it's rare, but it is serious. And so I hope that makes sense. I hope you all enjoyed the video. Please like, subscribe again. We enjoy making those videos for you, and all your comments, likes gives us motivation to keep doing it. Have a good day, everybody.